And hello, everybody. This is Kathy Frey from IMCO, from the International Integrated Maternity Healthcare Organization. And welcome along to this week's webinar. And we're very pleased to have from the other side of the world today, Loredana. Say hello.
Hello, everybody. Very happy to present this acupressure for induction of labor.
It is wonderful to have you here, Loredana. And what we're going to be talking about today is acupressure for induction of labor. And Loredana is going to be going over a case study, which I'm fascinated to hear about, because goodness me, if there's one thing that's over medicalized at the moment is the popularity of inductions. Okay, so that's going to be absolutely wonderful. And look, just a reminder to everybody, of course, it's wonderful if you can go onto the chat section and let us know whereabouts you are in the world and your role as a health professional. That would be fabulous for us to know. And also down the bottom of your screen is the Q&A button. And so if you've got any questions for Loredana, please do type those in and we'll absolutely make sure that your questions are answered before we wind up today. But just an introduction to Loredana for those of you who have not are watching this webinar a little bit later down the track. She is an independent midwife and also a freelance midwifery teacher, and completed her Bachelor of Science in Midwifery and a Master's degree at King's College and the City University of London. And she is a certified acupuncturist specialising in obstetric care. Although right now she's coming to us from Italy. And Loredana teaches midwifery workshops nationally and internationally on the use of acupressure for pregnancy and birth, and expanding birth practitioner roles, you know, so that we can become more complete and more independent as clinicians. And since introducing her workshops in Italy, many hospitals are adopting acupressure for labour preparation, the induction of labour, and for contraction pain management. And that's exactly, you know, that what we are all about striving for here, is that integration of our holistic wellness therapies with obstetric medicine. And so a huge welcome to you, Loredana, and we're going to be very fascinated to hear more about your case study that you're going to be going over today. A little welcome there to those that are putting some notes up in the chats. Fantastic to have you here. And I see we've already got a question. Oh, that's really a little hello as well. So welcome everybody. So the format today is I'm going to be handing over to Loredana, and she's got a PowerPoint that she wants to present to you, and then afterwards we'll have time there for questions and answers. So welcome Loredana, and please feel free to take over that screen.
Thank you for your nice introduction. Okay, I'm going to share a PowerPoint. It won't be last 20-25 minutes, so I'm really happy to answer questions after. Okay?
It's fantastic.
So it's a case study, acupressure for induction labor and augmentation in labor. It was one, as I said, I'm an independent midwife, and this one was one of the women I look after. Okay, first of all, I would like to acknowledge Deborah Betts and Sarah Bath for their inspiration and permission to share some of their material. Deborah Betts, she came over to Italy to teach, we teach together, and she's really been inspired. She's done a lot about training midwife regarding acupressure internationally. And Sarah Bath, she's a midwife and acupuncturist, which I did her training. She's one of my mentors. I did my training acupuncture in obstetric. So I really would like to take them. Thanks, man. So as I said before, this is a case study, which is one of my case studies, which reports that a successful use of acupressure for induction labor for post-maturity in a home birth situation. Was one of my lady, as I say, I do a lot of home birth, and I use induction labor. I use acupressure for labor induction. We all know that post-maturity can pose a risk for the unborn child, increasing the risk of stillbirth, particularly after 42 weeks, research say. First of all, I need to talk a little bit about the theory of Chinese medicine. Just what is Qi and what are the meridians, just the basic. Qi can be translated as energy of life force. It's like an energetic form of the vapor that you cannot actually see, but there's effect of such as lifting the lid of the pot. Chinese medicine is considered energetic medicine. Okay, so it's a lot of the imbalance of your qi in your body. Qi flow to the channels, meridian, which tend to be very bilateral, which are like a network of rivers that travel our entire body and connect to our main organs. What is acupressure? Acupressure is a pressure, it's not a massage, okay? Application of pressure to the acupuncture point, the same point you would use with needle. Acupuncture points are situated on the channels of meridian. As I said before, they are all bilateral in the body. How does it work? I mentioned before, acupressure is a technique that balances energy of qi in the body. The acupressure point most commonly used for induction labor is a very strong effect on blood flow to the uterus, promoting cervical dilatation, increases the release of prostaglandin and oxytocin in a natural way. We know that the prostaglandin are the hormone that makes labor start. So using acupressure, you actually start in labor naturally, increasing prostaglandin and oxytocin. Another important action that what acupressure does, facilitate the production of endorphin. We all know that endorphin are the normal, natural, like calming. It's like the hormone that makes you feel better when you stay with people that you love, when you do a lot of walking, exercise, increase your endorphin level. The endorphin make you feel the woman to relax, basically, promote physical and emotional well-being. The more you relax, the more you feel, labor will start in a way. When you are in labor, you can feel less pain as well. So progesterone and endorphin is one of the action. I use a lot in acupressure for industrial labor, and I've been teaching, as I mentioned before, I've been teaching in Italy and internationally, and a lot of midwife feedback and I suggest that definitely there are a change. There's a change on cervical ripening. Women then go into labor quicker. First stage of labor will be quicker. Induction labor will start. If we compare acupressure, the conventional method of induction labor, we can see that it's safe and there is no side effect. The most common method of inducing labor using obstetric are the prostaglandin and oxytocin. The prostaglandin obviously is seen to help a lot to soften and dilate the cervix and labor will start. However, there is a Cochrane systematic review that say that although it facilitates the delivery within 24 hours, there is a risk of uterine hyperstimulation, enhancing the risk of fetal distress. Because in a way, it's different that you're not providing, you don't use your prostaglandin, but you actually give the prostaglandin to the woman. And it's different because it's not naturally something that makes the uterus to contract much quicker, much stronger. And obviously you can have a problem with the baby, with the fetal. You can have a fetal distress. The same thing is the oxytocin. Usually the oxytocin is produced by the woman towards the end of labor, toward the end of pregnancy. But however, if we give artificially, it's different because it's not, woman doesn't have the time to sort of cope with the pain, and we're interfering with nature basically. What does oxytocin, which I've seen a lot for experience in my practice, I work in a busy hospital in London, where a lot of the time using oxytocin infusion, you can have a fetal distress. Because as I said before, uterus contracting much quicker and they reduce supply of blood and oxygen to the fetus. So you need to be careful using oxytocin. It's better if you can avoid, basically. There's been a lot of research regarding induction labor. The women felt empowered for action. Acupressure gives them the control and confidence during birth. They can have more choice, something they can do for themselves. You can teach the partner to use the point. So they felt empowered. They don't rely on doctor and obstetrician for induction labor, basically. Even individualized reported as well, acupressure is supporting and empowering women. This is like a Cochrane review. It's more a qualitative study. Okay, I'm talking about my case study. I was a 36-year-old pregnant gravida booked for home birth. I went to hospital induction, was booked for post-maturity at 41, 5 weeks of gestation. We tend to induce women in Italy, if they're not going to labor, spontaneously at 41 plus 5, 41 plus 3. So I went to see her because she stated that she was starting having mild contraction. She to her house, and the Bishop score was less than 6, which indicated a cervical ripening need. So I suggest the couple they should start using acupressure to promote cervical dilatation. The couple were trained and then practice using acupressure in my presence. I would make sure they know how to use the form which I'm going to describe. I was called, then I left them in peace because, you know, I listened to the fetal heart, they were okay, they know what they were doing. So I left. And after today, I was called as the woman was start contracting. On my arrival, I used a specific point as well to augmented labor, which I'm going to show you after, because she was not contracting regularly. Because as I mentioned before, not only acupressure can be used for induction labor, when the labor made the labor start, but can be used as well to make the contraction more regularly, to facilitate labor, basically. After a while, the contraction become more regular, 3 to 4 every 10 minutes. That's why I decided to do vaginal examination. The finding were that the cervix was effaced, anterior, and also 6 centimeters dilated. So she was progressing. Cephalic presentation confirmed the station of the eastern spine. She was making good progress. After 4 hours, the cervix was fully dilated, and then she had a spontaneous birth of delivery after 1 hour of a male infant born in a good condition, quite good sized baby, 3 kilo 800 grams. I'm just going to describe the point and then the way I will be using it. The first point is large intestine 4, which is on the large intestine meridian, as I say, bilateral. Okay, it's between the thumb and the forefinger. You need to apply firm pressure 5 to 10 seconds every time. What does the large intestine do? What the indication? Promote the labor because it tonifies the chi, give energy basically. And it's a good point as well for pain relief. So it just make the labor more efficient. Large intestine 4 need to be used together with spleen 6. Spleen 6 is located by using 4 of the woman's finger with above tip of the medium malleolus in a depression just behind the tibia. As well, spleen 6 promotes cervical dilatation because it invigorates the chi circulation into the pelvis. And then you use bladder 32, is over the second sacrum foramen with a pressure, as well facilitating cervical dilatation. This point can be used as well when we got cervical lips, because it's really giving more, bring the chi down into the area, okay? You do pressure. This can be done, okay? And then you go gallbladder 21 and the gallbladder meridian. You can see for the picture. It's the most tender point along pathway between C7 and tip of shoulder joint, a acromion process, at the top of the trapezium muscle. It's done a strong downward movement. This point as well can be used during the second stage when we're pushing to help the head to go down. Okay. Okay, as I say, we saw the point, and now we are going to see how we use the point. As I say, you use large intestine 4 and spleen 6, as you can see from the picture, those 2 points. Use bilateral every 2 hours. You need to cover all 4 points. Don't use those points at night. The woman needs to sleep, otherwise she's going to go into labor. She's going to be very tired, doesn't have any energy. Okay? And then you use bladder 32, the one on the back, gallbladder 21 twice a day. I think you can use more frequently if you don't. If you just, for instance, just have one day, okay, because the woman came to see you quite late, then you can use more frequent bladder 32, gallbladder 21. What is very important, I said before, to use large intestine 4 and spleen 6 together. Okay, the woman can use the large intestine on one end and use the split 6 on the leg on the other side, and then you change. You need to cover all 4 points. Okay, they work very well together. And then, as I mentioned before, there are 2 points that are pressure point that can be used, are very effective during labor. Anytime you find a woman that the contraction stop, even when I went to see this woman, as I said before, the labor, just to make the labor more efficient, because she was tired in a way, so you tonify the chi. You use large intestine 4 on left hand, and then you use spleen 6 on the right hand, and then you change. You do for about 20 minutes. For my experience, if you start doing for 10-15 minutes, you can see the difference. The woman, she has more contraction, okay? And then you stop when she starts contracting. Okay, what are the evidence? I believe that although it's very difficult to get evidence on complementary therapy because it's not so used, and sometimes there are not many studies, and then there's more research. There are not many research. I would say not money spent on research on complementary therapy, unfortunately. However, there are some research which are promising. Particularly one study by Ingram et al. 2005, which examined the effect of acupressure on the initiation of labor for women 40 weeks gestation. Unfortunately, it's not a randomized control trial. However, the results found that women that use acupressure for post-day pregnancy were significantly more likely to labor spontaneously than those who did not, which is very good because they mean less use of syntocinon and prostaglandin, which have side effects. Okay? A review by Moller et al. As well reported acupressure on spleen 6 and on large intestine 4 might reduce the length of labor, particularly on the first stage. However, this result doesn't really show that it seems to reduce the use of induction. So basically, what I'm saying is that there need to be more studies, especially a randomized control study, that we should compare women that they are using syntocinon with women that are just using acupressure. Okay. And then there is as well, I believe that from the point of view that you stay with the woman, you support the woman, you provide continuity of care, so support as well and touch seem to reduce the need of syntocinon, need to reduce that the woman feel less pain, the use of having pain relieving labor. So it's not only that you provide that, for instance, in this my clinical case, it's not that I provide just a point, it's just that I stay with her, I really sort of support her, be with her. This is better because she was very motivated to stay at home. So this is the therapeutic effect, the support we give to the women using acupressure. There is one important study about spleen 6, which I found very interesting. So in a Iranian study, use spleen 6 for 20 minutes, 5 minutes a day, starting at 39-41 week, because this is spleen 6 is a point that you can run your own, just that point at around 38-39 week. Okay, not used before because it's a point that can actually make cause preterm labor. Okay, so no use before 39 week, 38 week. Only used by this point. There was the study showed that the Bishop score enhanced after 48 hours in the researcher performed acupressure group. It is very interesting because this study said that actually if the mother which are trained to use acupressure spleen 6, they achieve better results, which probably they know which point to stimulate it, because I didn't mention before that the point that every acupressure point, you feel more different, is a sort of tender point. So this is a thing that is sort of empowering, so that you know exactly you use it on your own body, your own point, you know exactly what the point is. As I say, it's a quite good study, 2015, just those places. Safety, this is very important. The Acupressure systematic review by Caroline et al., 2020, regarding acupressure and acupuncture, acupressure for induction labor, reporting no known effect to the fetus. However, as I mentioned before, there are certain bodies not to be used before 37 weeks because they can stimulate labor. Those points are bladder 32, spleen 6, gallbladder 21, and large intestine, which are actually the point for induction. Conclusion. I think this couple were very happy, and I was very happy with life as well, because they were satisfied with their birth experience. So definitely they wanted a home birth. They didn't want to go to the hospital, which they had to go there to induce labor. So there was no need to go to the hospital for a medical induction labor. So as a whole, acupressure, for my experience, not only in this case, seem to facilitate a more natural and less medicalized childbirth, preventing potential problems which might occur during the medical induction process. As I mentioned before, we are using drugs which can cause some problem. Okay, so it's better if women can, with the acupressure point, which I mentioned before, can actually be the prostaglandin naturally, and the syntocinon, which is the oxytocin, sorry, which is the love hormone which makes them calm in labor, relax, and is most likely that the labor will start. What are the advantages? There are a lot of them, I mean, few advantages. First of all, it's not an invasive technique. Can be applied easily by birthing pattern, and the midwife promote birthing pattern involvement, comfortable, not painful, and safe. Especially if you use acupressure for pain relieving labor, the couple knows, you know, the partner knows how to do. You feel that you can do something, and it's quite easy to use. It's not that when you know the point and you practice. I tend to teach those points during antenatal classes or in a small group. So if the educator uses the point, you don't have to have a knowledge of anatomy. It's different if you need to sort of locate the needle. You need to be more precise. On acupressure, you need to go by the woman feedback as well, when she feels the point which is tender. So as I said before, increase the chance of a woman progressing from medical induction with minimal intervention, and seem to reduce cascade of intervention. Because obviously, if you got a fetal distress, it's most likely that you end up with instrumental delivery or a cesarean section.
Can I just interrupt for a quick little moment? Just got a question in there asking about what a Bishop score is. Okay. And just for those that haven't heard that term before, a Bishop score is something that midwives and obstetricians use to assess the cervix. So it talks of there gets given, it's a little bit like an ABGAR score that a baby gets after being born, but basically there's a score of 0 or 1 or 2 or 3 that's given to the cervical dilatation, the position of the cervix, whether it's posterior or mid or anterior, and it's the effacement level, that's how short the cervix is, and the station, and that's the how low down that baby's head is in the cervix, and the general kind of cervical consistency as to whether it's firm or medium or soft. So I'm just throwing that in there for those that wasn't sure about that one. And yeah, so I head back to you, Loredina.
No, thank you for this, because it's, I know it can be, it's a jargon. We are using jargon. Bishop, okay. So as I mean, being drug-free and therefore non-for teratology effect, the acupressure provide a better care to women, provide a much safer and satisfied childbirth experience. This is women's choice on method of induction. Yes, because there is no much choice in a way. So I strongly believe that it's not only in this case. As I said, I use quite a lot, and I got very good feedback from midwife as well, where they're using it, and even midwife themselves. You know, they came to my training, and then they use for their pregnancy, for their labor, and it's definitely they go a lot of the time. They really help them to go into labor without using any drugs. So I believe that is quite good. These are all the reference. I did a master midwifery with a talk about literature on the use of acupuncture in childbirth or other. Okay, this is just my email. I'm quite happy to answer all questions if it's, you know, if I'm interested in more information. Okay. Okay.
Oh, sorry. I had a technical glitch going on at my head.
Don't worry.
Talking to no one. Yes. So look, fantastic. And one of the questions that have sort of come in is, you know, can acupressure be used in conjunction with other complementary therapies? Well, I mean, a very strong answer, yes. But would you like to go into a little bit more detail on that?
I tend to, I'm a reflexology. I've done a training in reflexology as well. So just one quick example. One of the kidney one, which is a point on the foot, which was not on my PowerPoint. However, is a very good point for calming, you know, because it's relating to the kidney, which is every organ in Chinese medicine is related to one emotion. Okay, the kidney is related to the fear. So just one example. This is the same point you'll be using on reflexology. So I'm just thinking, if you are an reflexologist, you would use kidney one. For me, it's a kidney one on Chinese medicine, on the meridian kidney, but it's the same point. I'm not, to be honest, I think personally, I know more Chinese, I know Chinese medicine, obviously, because it's my area of expertise. I think some by combining, you have to have the knowledge. I don't like combining, for instance, homeopathy with my acupressure. Unless you are an expert, it's going to be difficult. What it can be combined, I'm talking about complementary therapy, with aromatherapy. I love aromatherapy. I've done some training as well, not so like my Chinese medicine. However, there is some indication where you can use the oil on the point. However, you need to be careful because if the woman's got some reaction, is allergic, I don't like too much combining few complementary, too many complementary therapy. This is my way of practice.
Right. It is, yes. I mean, it is about using, you know, all the tools in the toolbox as they're appropriate. So certainly there's some wonderful birth preparation herbs that are available that, you know, you could be using, for example, from 37, 38, 39 weeks. And then, you know, when women are actually in labor, that's when you know, the use of acupressure can be particularly, so it's about sort of understanding the usefulness as well of all of these different tools, and when they can be used, when they're great to be used. And just as an interesting aside, this is not any kind of case study, but just really a reflective of fact. There was when I look at, say, for example, the last 500 clients that I had as a caseloading midwife, I had about 6 who required an induction solely for the purpose of being post-dates. So obviously I had clients that needed inductions for other reasons, but purely just for that purpose of the fact that they're, 41 weeks and 5 days, and they've got this system kind of screaming down their back, going, you need to go into spontaneous labor. Yeah, I've only had 6 clients that required that, which is actually phenomenally low. And that is, I think, because of so much use of complementary therapies in those weeks from 37 weeks onwards. So so it is about you knowing, what to use when. And certainly if you do absolutely nothing with complementary therapies and then only rely on, this one tool at 41 weeks and 5 days to suddenly make things happen, your chances are not going to be so great. So, but as you're saying, Laurentina, what you don't want to do is pile everything on top of each other all at the same time. And yeah, so it's just that balance, isn't it? Now we've got some other questions coming in, which is fantastic. Could you go over the L14 SP6 and using both together and changing hands?
Yes, basically the woman can do on the left side, okay, which is a point conversa, and then the midwife or partner, whichever is staying the woman, supporting the woman, use the other leg opposite, okay, on spleen 6. I know it's difficult when I'm so used to do face-to-face, when you do practical training, it's difficult. So this side and the other side, left and right, okay, on spleen 6. And then you change, because it's important that you cover all these points, all 4 points, okay? And then after 2 hours, you do again the other side. You do again all those 4 points. Is it clear?
Yeah, fantastic. Another question in, is acupressure used in the UK, and are NHS midwives allowed to use it? It seems very effective in induction of labour. I like the fact that it is drug-free.
I think that is okay, we're not using needles, okay? It's different if you use acupuncture, because you need to have a proper training. In some countries, for instance, midwife cannot even, I'm an acupuncturist, I cannot even use needle in Italy because I'm not a doctor. Okay, so the problem is, it's not, women can go on the internet and look at the point, okay? So often say, it's very sort of, you can learn to use this point in
that's right.
Workshop and things. So I think we are too much going into this sort of guideline. As long as you know that you are responsible for your own practice, so you obviously have to have a knowledge. I put in there. In fact, I do a lot of training as well. I'm starting to do some training in England, okay? Because we are using a lot of acupressure in Italy, because I've been training a lot on midwives, so we tend to use a lot. In England, not much, but now it's getting more popular. I believe in training, especially now that you can do face-to-face. So obviously you need to know your point. Yeah. And as long as you know.
Yeah, and in general terms, within midwifery all around the world, midwives are encouraged, welcome to be using complementary therapies as part of their practice, so long as they've received training in that. So, a lot of midwives, because there are so many different options as well, so a lot of midwives within the course of their practice, over years and decades, will often, just as Laurentina has here, have become are interested in particular areas and specialized and knowledgeable in those particular areas. But so long as the midwife has received training in that particular complementary therapy, then that's regarded as, you know, reasonable to be using. So you'll find some midwives are using it, particularly with complementary therapies in general. They tend to be utilized more by the independent they call them independent, but really the better word is self-employed or caseloading midwives who are out there in the community 24/7 on call, seeing the woman during their pregnancy, attending their labor, doing home visits postnatally. So those midwives tend to be the ones that you are in this, have the opportunity to utilize those complementary therapies more, whereas the what we call the core midwife, or the midwives who are doing shift working at the hospitals, they, I guess, have a little bit more limited ability, because, you know, they only see the woman for a short time. But certainly there are birthing suites around the world where those core shift working midwives are just like, or Lauradina has it in Italy there, where they have received training and they are utilizing those complementary therapies on, you know, within the hospital system.
Yeah, especially as you say, on the birth center is easy. However, I know either one of the midwives when I did on my online training from working labor ward. I think nobody stopped. If you are knowledgeable, if you know the point, nobody's going to stop you to use it. There is no legal. The problem, I think, in England is that a lot of midwives think that they must have a guideline, okay, which is okay. I mean, but you cannot have a guideline for everything in a way. If you form the woman, you know the woman, you met the woman before, she's happy to use complementary therapy. You give them choice to use pain, for instance. You can use acupressure, is very good for pain and labor. Pain and relieving labor. You inform her, she's happy to use it. What do you need a guideline? Sorry, I'm a little bit. Although I know that guidelines sometimes they're okay.
Yeah, it's right. And I mean,
the guideline on acupressure, that the problem is that they think that there is not enough evidence. We are talking about evidence medicine, but in complementary therapy, evidence medicine is not so easy to achieve, because, as I say before, it's not so widely used. It's difficult to do, but there are some studies which prove that
that's right. And often the evidence-based studies are using those empirical kind of measuring sticks, so to speak, I almost just can't be used on some of the complementary therapies. You know, I know, just as a crazy example, but say within homeopathy, you know, there's about 50 different remedies for a cough. So depending on the symptoms of the cough. And so how do you do a double-blind trial on 100 people using homeopathy on a cough when they're going to need to use different therapies? And it's often with that, with complementary therapies, it's just sort of it's like trying to use apples to compare oranges, and that's sometimes part of the issue. And then on top of that, there's often funding issues, because with drug tests, you know, they're funded by the companies that produce the pharmaceutical drug. So where does the fund come from to fund complementary therapies when nobody's going to make any money out of the end of it, at the end of it? So we've got problems within creating or sourcing really good hard data. But the wonderful thing with acupressure like this, you know, when you've got a woman who is post-AIDS, is, you know, she has nothing to lose to be using these.
But the students now are getting more sort of into this. For instance, I just want to, you know, I teach maxibustion for turning the breech as well. This is one. I think it's very useful. The Royal College of Obstetricians now mentioned that together with sternal cephalic version, okay, maxibustion is sort of recommended and suggested. So for me, this is a good advantage. The Royal College of Obstetricians say, the woman can actually try moxibustion, means that I think this is a good result.
Absolutely.
So what I'm trying to say, we are moving into sort of like getting more understanding and accept, particularly for the moxibustion deliveries. Okay, and unfortunately, I'm going to teach in future. It could be used more because you give more options. Because obviously, if you offer moxibustion for breech, the baby will turn 60% of the time, statistically all the studies say, and they will avoid a cesarean section. I think this is a sort of quite good.
Yep, and then also there's that kind of logistical issue of how is it provided. So things like moxibustion being used for a breech situation. So it's not like, whereas the system is geared for prescription sort of writing, isn't it? You know, so you see a specialist obstetrician who confirms, yes, it's breech, we need to book you in for a C-section unless we can get this baby turned. And, you know, if they could just write a little prescription out and say, here, go have some moxibustion, but that's not how that quite works. So it is that sort of, I think that, you know, every decade, the system is improving between the communication and the use of complementary and alternate therapies to mainstream or medicine. So we are getting there.
But to answer the question before, I was thinking that in practicality, you say it can be combined. I've seen using some point, a woman was in hospital, she was having prostaglandin for induction. And then this Italian midwife, she started using the point and she started contracting. So the doctor came around. Okay, so the doctor came around to the woman, to the midwife, and say, "What you done to her? I think you have plagiarized, sort of influencers or psychologically." So what I'm trying to say, I mean, because somebody answered before, it can be used together with I mean, it's difficult when the syntocinon. So the syntocinon, you can use some point to help her to relax. But with the prostaglandin, when the woman can arrive, if you use the point as well, it seems to make the labor, she might need less prostaglandin, for instance. So to answer your question, what was the question? It can be combined with some other more
absolutely
traditional.
And, you know, about making you know, not always having pharmaceutical drugs or surgery as the first cab off the rank. So it's saying, okay, let's try this first. You know, so when we've got a woman, say at, you know, 41 weeks, and so it would be fantastic that it's a standard thing within the health system that they go, oh, look, you're 41 weeks. We really want you to get into spontaneous natural labor within the next week. So here is a guideline of points that you could be doing at home yourself, you know, and hey, presto, we don't get to that 41 weeks or 5 days or 6 days or 42 weeks where we need this prostaglandin. So isn't it? It's just about creating those systems where there's a combination of the two rather than go straight into the pharmaceutical drugs straight away.
Yeah.
So look, we are getting close to needing to wind up soon. Has anybody got any other questions that they would like to ask Loredana? Please put them in now, and we will answer those. It's funny because I'll tell you a story, but they're going back to a couple of stories that are relevant. They're going back to those half a dozen post-dates inductions of clients, over about 500 clients over that period of time. Interestingly, half of them were women who we know that they had fairly accurate dates. So we know those women were post-dates. However, they gave birth to babies that looked anything but post-dates, meaning covered in vernix. And really looking, and so I have my own suspicions that you know, everything varies in nature. And I think there are some women who are naturally are supposed to be 44-week gestation women. And so when they give birth at 42 weeks, they look like another baby that might have been at 39 or 40 weeks. And, you know, because and the opposite, we get women sometimes who give birth at 37, 38 weeks, who we, again, know their dates are accurate, yet that baby really doesn't look 37, 38 weeks. It looks 40, 41 weeks. And so everything varies in nature, but of course, we have to streamline things a little bit for that general safety, because we don't want, you know, we know that when women statistically go over 42, 43 weeks, we have increased risks of unexplained stillbirths. So that's why, you know, we use those guidelines.
I don't think. Now, just one important last thing I want to say regarding this induction of labor. Those points are very effective, very strong. Don't think that they are doing nothing away. In fact, it's better if you use them not too early. If it's not indicated, if a woman come and say to you, "Oh, I'm fed up. I just want you to get this baby out," and because my husband, for social reason, okay? Because really, you don't give enough time for the body to have its own endorphins, syntocinon, and all that. So you are interfering. So don't use before you got, like, it can be a medical induction. Okay, you can use before 2-3 days before the medical induction, or not too early, which is different. If there is a point, which I'm going to usually teach when I do my workshop, there are some point for preparation, like a protocol, and some point for induction. So I suggest don't use this point for induction too early, because the labor might start, but you might have a labor that will end up with complication because your body is not ready. Okay?
Yeah.
So
just like it needs to be medically indicated, really. Yeah.
It don't need to be medically indicated, because then there is nothing to worry. Just suppose you just rely talk with the doctor as well, which is involved with the team. If it is a medical induction, the day is fixed, then you can use 2-3 days before. But if there are if it's like, as I said before, 40 weeks, don't use just to get the labor start. Because it will start, but the body is not ready to produce their own, as I said before, endorphin, prostaglandin. So it's going to have a contraction in a cervix that cannot dilate it, basically. And then you are interfering with nature, you end up with a problem.
Yeah. So the point is, it shouldn't be utilized just because a woman is feeling fed up of being pregnant. And, you know, feeling fed up of being pregnant, I think is such an important part of the conclusion of the pregnancy anyway. You know, it's mentally, you know, a woman mentally, emotionally, it's so good to get to that point of going, "Oh, I'm so over this pregnancy. I just want to go into labor," because then when the labor begins, she's welcoming it. And, you know, we see it, don't we, Loredina, with women who have gone prematurely into labor and they've never got to that point of being fed up with being pregnant. And it's it can be such a shock for them emotionally. They're not quite ready, you know. And so we often deal, don't we, with women who are just so over being pregnant. And I always get excited for them when they're like, "Oh, I'm so over being pregnant. I just want to go into labor." And we're like, "Yay, that's fantastic. That's a really important place to get to mentally." And it's a wonderful part of that conclusion of your pregnancy, that you're over your pregnancy and you just want your baby to arrive, and you're prepared to go through whatever it takes to get that baby to come and well, to go through that labor. So being fed up, that's not the reason to be induced.
Or because the husband is going away or something.
Yeah. Yeah. So look, is there anything else that you would like to add before we conclude today, Loredana? It's been excellent.
No, I just think that is get, as I say, you get a lot of information on the. I'll send you the PowerPoint, okay? I don't mind doing the PowerPoint to people, okay? So
yes, so just a reminder, sorry to interrupt again, that everybody that's registered for this webinar will receive a email notification from Zoom, which will give the contact details for Loredana, and then you can ask her for a copy of the PowerPoint. But for those people who are watching this webinar later down the track and in weeks and months to come, would you like to just please now take the opportunity to give out your contact details?
Yes, I don't have a website. Now the good thing, I'm just going to be soon I'm writing a book, okay?
Wonderful.
Sorry, not just because it's no, the reason I'm saying this is because I don't have a website, okay? I'm not really sorted. I mean,
that's all right. Just having your email would be fantastic.
Loredana, L-O, I'm just going to write here. I write on the.
No, don't. I'm talking about for people afterwards, so they won't see the type.
Yes, of course. It's on the power. It's Loredana, Loredana _ Jordan, ZORDAN @hotmail.com. Okay. However, as I say, I'm just going to write a book. It's going to be in Italian and then I translate in English. The book will be about acupressure and oxybustion. So
fantastic. We need more of these books.
Sorry, I'm just publishing no. It's just because I think it's a lot of testimonial for women I've been treated with acupressure, and midwives are using it, acupressure. So
yeah, and we really do not have enough literature on all of these topics. You know, there's been over 20 excellent studies done around the world looking at the how popular complementary therapies are during pregnancy alone, and it doesn't seem to matter where you are in the world, what culture you are, what demographic you are. Consistently around 2/3 of women use some form of complementary therapies during their pregnancy. It's just looking at the pregnancy, and we don't have enough literature. You know, we don't have libraries and libraries and libraries of books on these topics because so much of it has been kind of underground, and it's important that we get this information out in public. Just a last question coming in there. So were we saying that acupressure needs to be medically indicated? Please explain. So okay, what we were explaining is that
when there is a medical indication, before I say 3 days before for post-maturity, let's suppose that you do, usually, I know in England they induce women 41 + 5, 41 + 6. They don't like to go over 42. So you do like 2 days, 3 days before, you can start the induction. When I talk about medical induction, is that when a woman needs to be induced because they think the baby is small or big or high blood pressure. Obviously, in this situation, you need, because so the induction is going to be early, basically. They're going to induce early for medical reason. In this situation, I really recommend, for the safety point of view, that you discuss with the team, with the obstetric team. You're telling them, you're informing the woman, obviously, inform that she can be induced or using acupressure. It's her choice in a way to accept it. However, it can still be used, but you need to be more careful and get the team involved, the obstetric team that you're using. What I'm saying that it doesn't cause any harm because she's going to be induced in any case. And just say you need to be more careful, rely with the doctor, okay? Because there are no point that it will increase. If a woman's got preeclampsia, okay, she's got high blood pressure, obviously, she needs to be induced. There is no acupressure point that's going to make her blood pressure higher. Actually, you can use kidney 1 in the foot, which is calming, is relaxing, it's most likely that the blood pressure will going to be down, reduced, okay? Because it's calm, it's going to be more relaxed. Okay, did I answer the question?
Yeah, and what we're saying is that when we say medically indicated, we say that it's the right thing to be going on. So that it comes back to that topic before of saying that just because a woman is feeling fed up is not a valid. Yes, so it's
sometimes they induce women for no reason. There are not enough good medical reason. I can see that point. You know,
yeah.
Completely. However, if you're going to be induced, medically induced, at least using acupressure, we can offer them, and it's most likely she's going to labor quicker without using less syntocinon, which it can make even more complicated. Okay, so this is my view.
Yes, yeah. Well, that is absolutely wonderful. We really appreciate your time today, Loredana. Just fantastic. And I see we've got a comment there that somebody is booked into one of your courses in London. So you'll be seeing them soon live. So that is fantastic.
I really hope that the coronavirus is going to be okay, because I like to do face-to-face. You know, I like to be.
Yes,
so,
I think that
very practical.
most trainers have. There's been a real change in how training is done in so many things. You know, with COVID, we're all behind the screen. So look, well, thank you very much for your time. Thank you, especially to those of you who tuned in live with us. And that's just fantastic. And it makes it easier for us and more enjoyable for us to have that live, you know, a good live audience as well. And thank you to those who are watching later on. So we just want to wish everybody a wonderful rest of your day and rest of your week. And thank you very much. So bye, Loredana. Thank you.
Ciao, ciao. Bye-bye. Take care. Ciao.
Bye.
Bye.